Today, we're diving into a really powerful and widely used medication, the immunosuppressant drug, azathioprine. We're going to break down what it is, who uses it, and the absolutely crucial safety measures that make it all work.
So, let me ask you a question. What if the very system designed to protect you, your immune system, was actually the source of the problem? It's a tough concept to wrap your head around, but for millions of people, it's a daily reality.
You see, in a whole host of autoimmune conditions, the immune system just goes into overdrive and starts attacking healthy cells. And that's exactly where a drug like azathioprine comes into the picture. It's designed to step in and manage that internal conflict.
So what is this stuff? Well, the best way to think about azathioprine is like a dimmer switch. It's not an on-off button for your immune system, which would be really dangerous. Instead, it just dials down the intensity. And here's the cool part. Once you take it, your body gets to work and converts it into its active form, a substance called mercaptopurine. That's the stuff that actually does the heavy lifting.
All right, so let's take a closer look at how this dimmer switch is actually put to use in the real world.
First up, who actually takes this drug? Because the answer is surprisingly broad. It covers a huge spectrum of conditions where the body's own defenses have kind of gone rogue.
And the list of uses is, well, it's pretty staggering. It's used for inflammatory bowel diseases like Crohn's, painful joint disorders like rheumatoid arthritis, even serious skin conditions. But one of its most critical jobs, preventing the body from rejecting a new organ after a transplant. It really is an incredibly versatile tool in the medical toolkit.
Now, here's where it gets really interesting. A drug this powerful isn't one size fits all, not even close. The dose is carefully calculated based on a person's weight and, of course, their specific condition. So, as you can see, someone with rheumatoid arthritis might get a totally different dose than someone managing Crohn's. It just goes to show how personalized this treatment has to be.
You'll also hear the term unlicensed use sometimes. Now, what does that mean? For a condition like severe eczema, doctors might prescribe azathioprine based on really strong clinical evidence, even if it wasn't one of the drug's original, officially approved uses. This is actually a pretty common and very carefully considered practice in medicine.
Okay, but let's be real. Dialing down your immune system is a big deal, and it doesn't come without potential risks. So the most important part of this whole conversation is understanding how doctors and patients weigh the incredible benefits against the potential side effects.
This gives us a really clear picture. On the one side, you've got the more common stuff. Because the immune system is turned down, there's a higher risk of getting infections, and it can affect your blood cell counts. But then on the other side, you see the effects that are considered rare or even very rare. This kind of comparison is so helpful for putting the risks into perspective.
Now, if you take away only one thing, let it be this. This is the single most important piece of advice for anyone on this medication. Any sign of infection, any weird bruising or bleeding that you can't explain, it needs to be reported to a doctor right away. That vigilance is the absolute key to safety.
On a slightly less severe note, feeling nauseous is pretty common, especially when you first start. But the good news is, this is often manageable with some simple tricks, like taking your dose with a meal or splitting it into smaller doses throughout the day.
So, knowing the risks, what do we actually do about them? Well, there are proactive steps, a whole safety checklist really, to make sure the treatment is as safe as it can possibly be.
And it all starts before a single pill is ever taken. There is a critical first step, a blood test. And this isn't optional. It's a fundamental part of the process to figure out how your specific body is going to handle the drug.
So what's this test looking for? It's checking something called TPMT. That's the specific enzyme your body uses to break down azathioprine. Think of it like your own personal processing plant for the drug. How well that plant works tells your doctor a lot about your risk of side effects.
And this process creates a really clear safety net. First, the test measures your enzyme activity. The results will show if your levels are normal, somewhere in the middle, or basically absent. Your doctor then uses that info to pick the safest possible starting dose. And if your activity is absent, you just shouldn't get the drug. Simple as that.
And speaking of safety, check this out. This is a huge one. If you're also taking a different drug called allopurinol, it's often used for gout, the azathioprine dose has to be slashed to just 1/4 of the normal amount. It's a powerful, powerful reminder to always tell your doctor about every single thing you're taking. All right, so the treatment has started. What does living with azathioprine actually look like day to day? Well, it's all about careful monitoring and keeping a few key things in mind.
In the beginning, the monitoring is pretty intense.
You should expect weekly blood tests for the first month or two just to make sure everything is stable. But as your body gets used to it, that frequency drops way down, eventually shifting to checks maybe every 3 months or so.
Of course, there are also special situations to consider. For pregnancy, it's a very careful balancing act, especially for transplant patients who can't just stop taking it. And for anyone with kidney or liver issues, the dose might need to be lowered. These are always decisions made with a specialist, weighing all the risks and benefits.
Ultimately, what all this really shows is that successful treatment isn't just about the pill itself. It's a genuine partnership. It's a team effort between the patient, who's responsible for reporting symptoms, and the healthcare team, who monitors, tests, and adjusts along the way.
So when you put it all together, what's the big picture here? Is it fair to say that azathioprine is, at its core, a balancing act?
Oh, absolutely. It's an undeniably powerful tool. It can quiet an immune system that's gone haywire, giving people relief and stability from some incredibly difficult conditions. But unlocking those benefits means respecting its power. It requires that careful management we talked about and a really proactive approach to safety. It's just a perfect example of how modern medicine can manage complex diseases through a careful, calculated, and constant balancing act.